Dear colleagues and friends, dear all colleagues who are interested in the work of the International Diabetes Federation, it was my plan as president of the International Diabetes Federation to give a regular update about the activities of IDF and the activities of the new IDF we have experienced at our Congress in Bangkok. And I just have seen that the last update is already 6 weeks ago. Maybe this is a sign that currently it's a very active phase for the International Diabetes Federation after our Congress in Bangkok and after the initiation of numerous changes for IDF. Those of you who have attended Bangkok have recognized that beside the new spirit everyone felt in Bangkok, there's also a new strategy called IDF100. And the 100 means that the International Diabetes Federation, who is now 75 years of age, should also be here in 25 years at the 100 years anniversary. And it's my intention to prepare IDF to become a strong organization who is prepared for the next 25 years. This means we probably have to initiate changes. And after Bangkok, we have initiated a steering committee consisting of 7 people representing all IDF regions. And we open all books. We ask all the unasked questions, the unhappy questions. And we got in contact with all of you, as member organizations. 180 member organizations participated in an assessment. We called it soundboard sessions and a survey to give their ideas about how the new IDF organization should look like. But also, we asked the young leaders in diabetes, and many of them, more than 50, have responded. What is their intention about the new IDF? And we worked with all the stakeholders and all the partners of IDF and all the people working in the IDF office. So we have a large collection of ideas how the new IDF should look like. And one of the big questions is in the, let's say, in the competition between the large diabetes organization, what is the asset of IDF no one else has? And it is being an organization representing patients and healthcare professionals in the same manner, and being an organization being very much dedicated to people living with diabetes in low and very low income countries. And this is exactly where my heart is beating for, where I think if IDF wants to have a global impact, it has to have the impact in low and very low income countries. A few days ago, we had the first board meeting of the new board of IDF, and we have discussed the current situation about this IDF 100 strategy. And it was mainly what is the input we got from all the organization. And I must say, I'm proud to be president of an organization where so many passionate colleagues, people living with diabetes, people with lived experience with diabetes, are enthusiastic and energetic to do whatever is necessary to improve the quality of diabetes care. Many people in different ways, but everyone is driven by this passion. And this is, let me say it, this is very cool to meet these people everywhere in the world. And so what would be the best organization to represent? And this is a question we are asking in the moment with all the input. And over the next weeks, we will define where to go. And then we will build an organizational structure to fully support this goal. Probably this will mean also to stop certain things. And but the result will be that we build an organization being fully dedicated to reach the defined goal to improve the quality of care for people living with diabetes everywhere in the world, but especially in low and very low income countries. Also, during the last weeks, I have visited colleagues and member organizations in Dubai and in Oman, in Abu Dhabi, in Al Ain. And it is it teaches me a lot. Yeah, I sometimes say in the last 1.5 years, I have learned more about diabetes than in 25 years before. And this is very true. And this is because of you, because of meeting you in your country, in your environment. This is the best source of learning you can get as a president of such an organization. And or what does this teaches me? I truly believe that any problem in diabetes care is somewhere solved, somewhere in the world. But the problem is we don't know from it. Yeah, and bridging this, fostering the exchange, this is also something where I'm very keen on it. In the last weeks, I also have been in Geneva at the WHO General Assembly, and this was very, very interesting. Being in Geneva, and you cross the street from one hotel to the other, from one meeting to the other, and you may meet two ministers of health on this way. And I have met a lot of colleagues from other NGOs, from colleagues who are very enthusiastic on the political level, on the organizational level, on stakeholder level, to act for people living with diabetes. And this fills me with a lot of hope that we are on the right way and that we have a realistic chance to improve the quality of care, but also to improve the measures of prevention of diabetes. So I'm very optimistic that we will be able to implement strategies to reduce the number of people living with diabetes. But one big unsolved goal is improving the care for people living with type 1 diabetes. And I think there are a lot of activities in place to improve the care if you are diagnosed with type 1 diabetes. But a big barrier is the diagnosis of type 1 diabetes. I assume that more than 50% of people having a ketoacidosis or developing type 1 diabetes and going to a community health center are not diagnosed because they are often misdiagnosed, for example, as malaria and so on, and then treated as malaria and die because of a ketoacidosis. So this number, I think we should do whatever we can do to reduce this number, that every person developing type 1 diabetes has a chance to survive, and surviving the first days and then getting access to affordable insulin treatment, affordable diagnostic measures. This is a big, big goal. We have to work on it. And I'm very thankful to the WHO. Their comeback goal says in 2030, everyone diagnosed with type 1 diabetes should have access to affordable insulin. And I must say, we are far away from this yet. But let's work to reach this goal, and let's work that people are not misdiagnosed, that a young person or a child having ketoacidosis really has a chance to be diagnosed as type 1, because in many countries, then you can have access to treatment. And during the last days, actually, I had the chance to visit Scotland, and I met with colleagues in working in digital diabetes care, and it was overwhelming positive what I had seen. A small country like Scotland, 5 million people living there, but having a perfect strategy to collect data, to evaluate data, and to translate this into better care, and having a good way to assess existing digital therapeutics and make them available for people living with chronic diseases. So you see, the time after Bangkok was a very active time, and we are in the middle of a process to build or to rebuild the International Diabetes Federation. And my personal goal is to build it into an organization where every one of us says, this is my IDF, and I'm proud to be member of IDF, or I'm proud to be partner of IDF. And this we are working for. I'm very thankful to Niti Paul, the president-elect, and thankful to the board of IDF. It's a very constructive environment to work together. And I'm very thankful to all the people I meet in function as president of the International Diabetes Federation. This passion and enthusiasm and commitment, this is very stimulating for me. Thank you that we are not only talking, thank you that we are walking together to improve the quality of diabetes care worldwide. Thank you for your action.